When it comes to our teeth, we usually think two things. One, we should take care of them by brushing regularly, and two, how terrifying it would be if pigeons had them. But of all the gooches and grundles that make up our dirty bodies, few play a more central role in our lives than teeth. We're even conditioned to base much of our self-esteem on them.
The first thing people notice is our smile.
Maybe you don't put a nice smile on your checklist for popularity, but it belongs there.
This is an all-American boy. The girls are wild about him until he smiles.
Sure, those chiclets are a problem, but as a woman, I have to say, he'll do okay with us because he is tall as Sorry, short kings. But as important as our teeth are, they're barely an afterthought in America's never-ending healthcare disaster. While more than 27 million Americans lack general health insurance, almost 3 times as many have no dental coverage at all. Even basic adult Medicare recipients are out of luck because it has limited coverage of dental, hearing, and vision. Hence its slogan, who needs a working head? We often treat going to the dentist as a luxury, which is crazy because dental care is health care. Gum disease is associated with gastrointestinal problems, increased risk of cancer, cardiovascular disease, and the medical diagnosis, stank mouth. In addition to all the Americans who lack dental insurance, there are also those who have coverage but can't get treatment. Medicaid patients often have a hard time because some states don't cover dental care, while 2/3 of dentists won't even accept the program's low reimbursement rates, which is terrible because everyone, regardless of their ability to pay, deserves to get buzzed on that awesome gas at least once.
Is this real life?
But David got hooked. Now he mules nitrous oxide for a cartel. Making matters worse, 51 million Americans live in dental deserts, low-income areas that dentists avoid in favor of wealthier neighborhoods where people have insurance. In their defense, the average dental school grad has to pay off $300,000 in debt, plus the costs of office space, staff, and equipment. I mean, imagine owing all that money and still not being a real doctor. The lack of access to dentists is a big problem for Americans. Obviously, dental care is not something you should DIY, as evidenced by this video. That's not how you clean your teeth. That's how a serial killer prepares for the hunt. Dentistry's profit-driven business model also creates a problem of ethics. To boost revenues, some dentists are turning to so-called creative diagnosis. I was hoping that meant my dentist would draw me like one of his French girls, but actually, it means pushing unnecessary treatments, ranging from root canals and gum grafts to expensive cosmetic procedures like teeth bleaching, veneers, and the always glamorous third row of teeth. There's no easy way to fix all of the problems in our dental care system, but one part of the solution is dental therapists. I know the term dental therapist sounds like someone who asks about your childhood while their whole fist is in your mouth, but actually, dental therapists are medically trained professionals. They do many of the same procedures as regular dentists while often costing patients less money, and none of us have ever heard of them before. That feels like a problem. Dental therapists are legal in only 11 states, but even a Trump administration report acknowledges they're a cost-effective and safe way to bring dental care to people who desperately need it. And the good news is, absolutely no one is fiercely opposed to them. I mean, right?
The American Dental Association is fiercely opposed.
We don't understand why anyone would want a lesser trained individual dealing with that population.
If I'm poor and I have a toothache, half a dentist or 70% of a dentist is better than zero.
Of course, half a dentist is better than zero. I mean, unless it's the lower half. Nobody wants their dentist's foot poking around in their mouth, except probably Quentin Tarantino. He loves them feet. The lobbying arm of Bigtooth has spent millions to make sure dentists' income isn't threatened by competition from dental therapists. That's money they could be spending on helping patients, upgrading their equipment, and finally getting rid of all their 9-year-old copies of Highlights magazine. Some shitty kid did all of the word jumbles in pen. Dentists may fear dental therapists as much as I fear drawings of teeth with their own smaller teeth, but that doesn't mean they're gonna put them out of work any more than nurse practitioners put doctors out of work. I promise you, America has enough messed up mouths to go around for everybody. We just need to fix our healthcare system so everyone can have access to affordable treatment, because not all of us can rely on being tall. Sorry again, my short kings.